about trauma. Hoping to talk a bit about trauma in the context of migration. So, and then I'm hoping people can walk away with like some common understanding of what happens to people following trauma. What are some ways that people could either help themselves or sort of like working with professional supports? And really just the whole purpose is to kind of get a better understanding of how trauma kind of happens during migration. Before I start, I just want to briefly sort of acknowledge the line that we gathered here today. So this afternoon, because the event is, we're meeting on the traditional unceded territory of the Algonquin and Anishinaabe people that have been living here for since the beginning. We're really kind of grateful for the opportunity to meet on this land and also live on this land, as well as thanking people who have been taking care of this land for thousands of years. And for me, I think about how that's really important, particularly given that we're all settlers, right? Rather, we're like new Canadians who have just arrived, or those of us who have been here for a little bit longer. But like just even kind of talking about why we're doing this. So this afternoon, I'm hoping to talk a bit about a few things. One is that why is it resettlement and migration being actually a really, really challenging experience? I'm hoping to talk a bit about exactly what is trauma, how do we think about what trauma really means, and then what kind of happens to some people after experiencing trauma, particularly within the context of mental health addictions, which is where a lot of my training and knowledge is in. And then I'm hoping to leave people with some resources as to what are some things that you can be doing now, even after, as soon as the presentation is done, if you have experienced trauma or maybe some other mental health concerns, what are some things you can be doing now, as well as what are some things that you may be able to do once you kind of get more connected with various different community supports. Folks, feel free to sort of stop me. If you have questions, please kind of feel free to jump in. I do know that talking about trauma can be really difficult sometimes for those of you who may have experienced trauma, or even thinking about like what's going on in the world right now. It can be quite triggering. So if you do need to pause, feel free to do so. You can pause, you can come back. And at the end, if you're still experiencing some distress, I do have some like contact information for you to kind of reach out for some supports, just because again, talking about trauma can sometimes bring back difficult memories. Usually in these kind of workshops, I ask people, even though you may have experienced trauma firsthand and you may sort of want to kind of share about your personal experience, I ask you to kind of hold back on some of the details related to what might have happened. The reason is not because I'm not interested, but rather is that sometimes when people talk about like really kind of personal traumatic events openly in space like this, it could be quite triggering for other folks in the room. So I just ask that we sort of create like a psychologically safe space, so to speak, the safer space. Okay, let's kind of talk about what exactly is resettlement and why is it so difficult. So when I think about resettlement, I'm really kind of talking about like 3 stages of kind of resettlement that most people experiences. So sometimes people experience a lot of hardships in their home country, and sometimes like the move itself to Canada can be incredibly challenging. And then afterwards, getting resettled in Canada has also its own challenges. So I'll kind of dive more into details on that. Oftentimes, not always, and this is certainly not like what everybody experiences. But that being said, these are sometimes some difficulties people may experience at home. I think about lots of us who come as immigrants and refugees. Certainly, like there's a loss of that ability to kind of live our everyday lives while in our home country. Maybe something has happened, or maybe, you know what, things were always kind of like going okay, but at the same time, like something has sort of like led to the idea of like maybe it's time to kind of think about exploring a different place to live. Sometimes it could be like very concrete events, like very difficult events, including war and violence. Lots of people who may have experienced like poverty, like having a hard time, like really kind of meeting their basic day-to-day needs while in their home country. So of course that makes life incredibly challenging and incredibly difficult. Sometimes losses happen, particularly when people might have been living in a place where they experience wars and conflicts. They might have lost their friends and family members, and also sort of like leaving them behind, or even within the home country, people kind of moving about, and they may have to like leave their friends and family behind. lots of people might have experienced violence, assaults, injuries, all different types of violence, whether it's like physical, emotional, sexual, and other types of violence and assaults. Discrimination is something that comes up quite often at the home country, particularly when I talk about discrimination. Sometimes like people may be treated really poorly, sort of at the lowest extent, to like having like actual violence experience because of their gender, because of their sexual orientation, because of their religion and spirituality, because of who they are in terms of culture and race. Sometimes people also being persecuted for their political beliefs. And of course, there's many, many other reasons why people may experience being treated poorly and violence. While leaving is incredibly challenging. Like making that choice to leave your home behind is tough, right? Like I think about how sometimes if we have to leave like lots of things behind, we're leaving our homes behind. Sometimes that people may have to leave like really abruptly. Let's say for an instance of like a war or conflict is like things are fine, awesome, things are not fine. So people have very little amount of time to sort of like pack up like really the key essential things that it can bring, because obviously you can't bring every single thing with you. As well as while leaving, people may encounter additional violence. While leaving the home country, people may also be like separating friends and family during the process itself. Some newcomers may have also experienced like really difficult conditions while living in refugee camps or detention, where, like government detention, because they have crossed the border irregularly. Like by that, I mean like sort of like not the typical way someone may cross the border, and then they may sort of get caught, unfortunately. And then obviously in these refugee camps and detention centers, living conditions are really poor. There may be sort of more violence that happens either by like the violence caused by either people running those facilities or also like other people living in those facilities, whether it's refugee camps or detention centers. So then what happens afterwards once we come to Canada? Of course, like people may have all types of emotions, all sorts of mixed feelings around arriving in Canada, but some of these sort of more challenging parts of after coming to Canada could be just having a hard time like meeting their basic day-to-day needs. Living in Ottawa is very, very expensive, particularly now when we talk about inflation, but even before then, Ottawa is a very expensive place to live in. So sometimes having a hard time balancing the amount of like financial resource, the amount of money that you have with like, how do I prioritize? Is it food? Is it housing? Is it clothing? Is it something for my kids? Is it I need to maybe still need to send money back home to my home country because I have family members I got left behind there? Learning English or French is also really, really hard as adults. I think many of us can relate to that. Like those of you who have kids, you can see that your kids have a way easier time to pick up English and French. But for us adults, like it's really challenging to learn a new language, especially when we have not been exposed to the language beforehand. Coming to Canada also has a lot of like lots of people have a hard time finding work. So by unemployment, it means that like just not able to find work altogether. The other sort of challenge that many newcomers experience is called underemployment. So what that means is that you are maybe trained in your home country as a doctor, as an engineer, as a teacher, but after coming to Canada, not able to kind of find work in those occupations. So as a result, you may be working in something completely not trained. You may be sort of working in a restaurant, for example, and really sort of your skill level here, you have these like really professional skills, but at the same time, you're not able to apply them, and therefore you may have to work in a job where you may make less money. So that's underemployment. Unfortunately, discrimination is something that's more common than we think it exists in Canada. Sometimes people experience like really sort of overt. So what that means is like kind of in your face type of discrimination, that sometimes people may also experience violence from those discrimination. the other thing about discrimination is that sometimes it could be like much more subtle, right? And so people sort of asking things, for example, like, well, where are you really from? Sort of implying that you don't belong in Canada, or like even going to a store and the store workers kind of following you along the store. It's like, what is going on here? Like, is it because of is it because of is it because I'm doing something like weird, dodgy, or is it because of my skin color that you're facing me, following me around the store? I see that there's a question. Do you think that's a good idea to bring over so many people in upcoming months, years with inflation happening? Would that not just make them struggle even more since citizens? I mean, like, so Hassan, I'm looking at a question on the chat. I think is a good question to ask. It's certainly a really tough question to ask, right? Yes, inflation is kind of happening, which makes life more difficult here. And at the same time, when you think about all the events that's kind of going on in the world, people need to leave. People need to leave desperately. So I think like sometimes like people might have to face that difficult choice. It's like, yeah, going to Canada is going to be really, really expensive and it's a bit tough. Yet at the same time, it's not as tough as staying at home. So unfortunately, people sort of face to make these like really hard choices. That good question though. Coming back to this, I was talking about discrimination, and then sort of like also after moving, people's family dynamics also shift, right? So thinking about sometimes like people may come from cultures where usually the classic example would be like usually the men would be the one going out go to work, whereas like mom's kind of staying home, maybe with the kids. But then because of having a really hard time making ends meet, maybe both dad and mom have to go to work. So as a result, that family dynamic will kind of shift, right? Like now, maybe perhaps like both dad and mom have to also do more chores at home. Or mom may also have more of a say in terms of making decisions because mom is also bringing home money, right? And so that like kind of shift that family dynamics, which takes time to kind of readjust. And then lastly, the idea of culture shock, which I'll talk about now. So when I think about culture shock, like I kind of see this idea of like a sort of like U-curve. So what happens to people when oftentimes they first arrive is that they go through this like honeymoon phase, right? It's like, wow, like I finally made it. I've been waiting for some time to come to Canada, like thinking about like all the really hard things I've gone through, and I finally kind of got into Ottawa. Things are kind of new, things are maybe exciting, things are very different than at home. We sort of pick all of the things that we like. Oh, like at home is things are like this, but in Canada it's like this way. So it's like cooler or maybe more exciting. But then what sort of happens after the honeymoon phase is that people will start to experience some uncertainty and doubt. People start kind of questioning, well, did I really make the right move back at home? Maybe I was an engineer or a psychologist, but now unfortunately I can't find work in that field. I am told that I need to go back to school completely and just spend like the next like 4 to 6 years to be retrained, even though I have all the skills already. And now I'm kind of working a job that I don't really like. I don't make as much money as I want to. Did I really kind of make the right choice? What else? And I'm experiencing all these like hardships. Like learning English is really hard. Like, why am I kind of putting myself through this? Why do I have to go to work and then also do like English as a second language class after work? Is like I'm basically going to work and school at the same time. It's really challenging compared to at home where like I had this really nice job that I was able to go do my thing, make money, and then come home and actually have so much more free time. People also sort of miss home a lot. That's really, really common. They're thinking about like people they might have left behind, worrying about them perhaps. So people may sort of experience that kind of this like uncertainty and doubt part that comes down afterwards, where it just brings down a lot of the more pleasant emotions and might bring up a lot of the unpleasant emotions. Hopefully, for most people, they're able to kind of get to this adaptation stage where after a while, getting more settled in, becoming more familiar with Ottawa and Canada in general, picking up more English and French skills, making some friends who are maybe a good mix of people, maybe some people from back home, but maybe also some people like back home as in like the same culture as people back home. And then maybe also making some friends who are either also immigrants or maybe also like sort of white Canadians, so to speak. The idea is sort of like creating new connections, creating new network. And then hopefully in the ideal world, we get to this like acceptance stage where like we're kind of accepting that, yeah, like I did move countries. There's parts of like being Canadian I really like. And then there's also parts of being wherever I come from that I really like. So how do I find a way to try to like make those two things fit together, and at the same time accepting that, yeah, like there are some things I really miss at home, and that's okay, because I hopefully one day will be able to kind of go back home and visit and have built those connections, or maybe I found like new ways to sort of do those cultural things with like new people that I met in Canada, so to speak. So then let's really kind of talk about what is trauma. So this is a definition that's sort of created by the Center of Addictions and Mental Health. It's like a mental health center in Toronto. They are sort of one of the most, I don't want to say important, but one of the biggest sort of mental health sort of treatment services within Canada. And the way to think about trauma is that it's something that really lasts for a long time. People experience like tons of overwhelming emotions, and they last for a long time, that came from a really distressing event. And for everyone, distressing events can mean very different things. Like I was talking about a number of very distressing events, sort of like pre-migration, during flight, and also once after arriving in Canada. But for you, a distressing event, for someone else, maybe they're like, oh, it wasn't so bad. But for this person, distressing event could be, you're like, well, it's not so bad for me. It could be sort of one event. But certainly when we talk about like newcomers, it's never one event. It's always sort of like there's multiple events that have happened. Thinking about, so well, we talk about those like stages of like moving to Canada. And so like distressing events can happen in those stages. And the problem is that like the distressing events, they all kind of like built on top of one another. So like if you had experienced something that's really hard at home, coming to Canada, it's also really hard. So they kind of like just layer on top of one another. So what happens to trauma is that it really sort of like impact the way we think about how can I be safe? How can I sort of create safety in the environment around me? Who would I think of myself as a person? And I'll talk more about that in a moment. Regulate emotions. So what that means is that like, how do we sort of manage emotions that are really unpleasant? And sometimes like with emotions that you all probably know, like it can have this like range of intensity, right? Like I can be sort of feeling low range happy, yeah, I'm okay, I'm generally content, to like I'm ecstatic, I'm so excited, I can't wait to sort of like do this thing. The same thing for like more unpleasant emotions, right? Like I can be sort of feeling, yeah, like today was not great, like I'm a little bit sad, to like full on like I'm really depressed to the point that I can't do anything anymore. So having hard times in managing that range of emotions. And then also trauma impacts the way we have relationships and connections with other people. So long after what trauma happens is that people who experience trauma can still feel shame. So feeling really bad about who they are as a person, feeling helpless. I can't control my environment. I don't know what to do. And powerlessness. I have no say. Like things just kind of happen to me. Even I try, like nothing will really kind of change. And then being really afraid is another common trauma response. I don't know how many of you have heard of this before, but it's certainly something that hopefully is not, once I can explain it, like, oh yeah, of course, it sounds intuitive. There's the idea of like fight or flight response, but really in psychology research, we see that there's actually more to fight or flight. There's also freeze and fawn. And when you think about it, it actually makes a lot of sense, because these are not only just humans who do it, animals also do this, right? So what happens is that fight or flight response is kind of like an alarm bell that we all have inside. So every time the alarm bell goes off, we're going to check out what's happening. And then it's like, if there's something that's dangerous, we fight back. So animals do this, our human ancestors, like, so people way back when, like tens of thousands of years ago, had this, whereas like I am walking, I don't know, if I'm a hunter-gatherer, I'm walking, trying to like hunt food, but then I realize there's a bear that's coming towards me. I need to decide very quickly, am I strong enough to fight back this bear, or do I need to get the heck out as soon as I can, right? And so that's sort of like very automatic kind of response that happens. Sometimes we may also freeze, so that what happens is like, we see animals doing this, humans also do this, where it's like, I just need to kind of like freeze here, and is a way to kind of like protect me. And then fawn can also happen, where it's like I'm just to find ways to kind of avoid that danger, so to speak. So what happens to trauma is that like trauma kind of almost in a way caused that like our natural body's alarm bell sort of not working properly. So when you think about our alarm systems, like every single time, yeah, I hear the alarm, I should get out or I should fight back. But then what happens when people experience trauma is that that alarm bell sometimes is going off, even though there's nothing that's dangerous, or that alarm bell is just constantly kind of ringing. For those of you who may be living in an apartment building, you know that with sort of like fire alarms, right? Sometimes like, the fire alarm is kind of just going off for no apparent reason. There's actually no fire, no danger, but the alarm bell is still going off. And then what happens with trauma is that like, if the alarm bell is every time it's going off, I need to get the heck out. I'll be spending a lot of like energy, both physical and also emotional, right? Like if I think that there's a fire all the time, I'm going to be really afraid to think about how do I get out all the time. So I was talking earlier about how it changes the way we think about ourselves. So what happens with trauma is that like it kind of changes like the thoughts, like what's going to go through in our mind. And in a way it changes, like it's common for like thoughts to change to the point where we start having these like more unhelpful thoughts, so to speak. And we kind of group them in three categories. One is about me. So maybe after trauma, I start having lots of thoughts like, yeah, I just can't really control what's going to happen, because for so long everything was unpredictable, like things were fine and all of a sudden they were not fine. So what am I supposed to do? Like I don't have any say about what's going on. Sometimes that people may also have a lot of like self-doubt. They start thinking, well, I should have done this, or no, I should have known better. I should have saw it coming. If I saw it coming, then I'm able to kind of escape from this danger. And as a result, I wouldn't have been hurt. Unfortunately, people who've experienced trauma also carry on to go and develop a belief that maybe there's something wrong about me. I'm broken as a person. So those are some things that maybe relate to me. Some more unhelpful thoughts related to other people is that, yeah, see, like this is like, look at all the things I've experienced. These are all reminders that other people cannot be trusted whatsoever. Or if I let them in, if I let them to get to know the real me, they may hurt me again because I've hurt by other people before. And then so the third group of thoughts would be more related to like the world being, for example, the world is a dangerous place. Like look at all these things that happened to me. And I need to kind of keep thinking, yeah, the world is a really dangerous place. You can think about a moment here where if I believe that the world is a really dangerous place, I may start to change my behaviors, right? I may sort of like intentionally do less things. I may hide myself all the time. But then the more we kind of hide, the more we tell ourselves the world is a really dangerous place. So that people kind of get caught in this like merry-go-round, so to speak, this like sort of like loop that if I believe in that, I do less, and then I sort of believe in that even more because I'm experiencing the world less. And then certainly thinking about the future, my future is helpless. My future is, no, sorry, I'm helpless. So therefore, and maybe my future is hopeless. So here are some common kind of reactions to trauma. And just because people have experienced trauma doesn't necessarily mean that they're going to experience all these things. In fact, like people are very, very resilient. So what that means is that people have a way to bounce back. May not bounce back to sort of the previous level where they're at. They may kind of bounce back here, or sometimes people may also bounce back even up here. So what that means is that people, actually really strong people, it takes time to bounce back. Some people bounce back faster than others, but these are some sort of common experiences that people may sort of think about. Do I want to get some more help on this? So one common experience that we have just talked about already is like just being afraid for a really, really long time, being afraid like really, really often. That fire alarm is going off all the time, and every time that fire alarm going off, I'm like, oh my god, like this is it. This is the time that is going to happen. Keeping away from other people. So it makes sense, right? Like when you think about trauma, how we may feel sort of like really bad about ourselves. We're afraid all the time, so that we might just want to stay away from other people, asking those questions like, what if I kind of get hurt again? Or I'm just really like ashamed of what happened to me. Trauma, when we talk about trauma, people sometimes experience violence, people experience injuries. And so sometimes with those violence and injuries, they also experience physical pain that may stick with them for quite some time. Obviously, our mind and bodies are like interconnected like this. So even though for some people, the physical pain may not have a cause, like it's not related to injury, but they may still experience physical pain. It may kind of speak to the level of emotional pain that we're experiencing. So for a lot of people, sometimes like when they experience emotional pain, it kind of comes out in the body. So that physical pain, emotional pain in like relationship. Having a hard time concentrating, having a hard time learning, which again, when you think about it, it probably makes a lot of sense, because if I sort of like constantly looking out for like what like the other shoe to drop, constantly looking out for signs of danger, I'm gonna have a hard time sort of focusing on now and the present. That idea of feeling helpless, I don't have control that I talked about before. And then certainly for some people who experience trauma, they may go on and develop mental health and substance use problems. Well, we talk about trauma, like most people oftentimes think about like PTSD, which I'll talk about in a moment. But depression, anxiety is actually way common. It's really, really common too. As to what happens to people after trauma. And these are some signs and symptoms of depression. And certainly this list is not meant to be like, if you're looking at it, you're like, oh, that one, that one, that one. This is not a way to sort of like diagnose depression per se. Definitely talk to your doctor about it. But these are some sort of like signs that you may want to kind of look out for. Feeling sad, feeling low all the time, not really kind of interested in activity, or even if I'm doing something, it's not fun. I'm kind of like pushing things off. Maybe my friends are asking me, do I want to hang out? And it's like, no, I don't know. Maybe I'm going to cancel plans. Just feeling like more like you're talking and moving more slowly, feeling tired all the time, having no energy, that sense of like feeling really guilty, having sleep problems. Certainly like sleep problems was going to come up a lot for sort of various mental health stuff, because our sleep and the mental health are also really related. If we're not sleeping well enough, we may sort of have, if we're not sleeping well enough, whatever mental health problems we're experiencing may get worse. And then as these problems get worse, our sleep also gets worse. So sleep, for some people, it could be having a really hard time falling asleep, waking up in the middle of the night, I don't know, waking up like 3, 4 in the morning and just can't even get back to sleep. So waking up way too early. For other people, it may be like sleeping too much. And again, like it's one of those things that it becomes one of those like chicken and egg thing, right? Like if someone here is sleeping, I don't know, 12, 14 hours, they may actually just feel more tired, because like what that actually happens to people when they oversleep. Or the other thing is like, well, if I'm sleeping 12 to 14 hours, I just also have less time to kind of do all the things that we need to do. And then I may sort of feel more overwhelmed, right? And then I may sort of like say, I can't do this because it's way too much stuff to do. Concentration problems could be a sign of depression. For some people, it could be a sign for something else. But when people are depressed, they tend to have a harder time to kind of focus, and they also have a harder time to kind of like make decisions. And then certainly for some people who are experiencing depression, they start having thoughts about hurting themselves. if that were to happen, if you ever have those thoughts, this is something that needs to be addressed right away. And what I mean by that is I'm gonna leave some resources at the end to sort of like help people to kind of like if people having those thoughts, like talk to someone right away or talking to their family doctor right away. Just because like those thoughts, for some people they kind of pass. For other people, those thoughts may get more and more intense over time. So that's depression. Depression and anxiety are both super common, and sometimes when people have one, they go on start developing another. So by anxiety, I'm really kind of talking about worrying a lot, like to the point that it's called excessive, like too much. Worrying a lot about different things, right? Like maybe I'm worrying about money, worrying about my future, worrying about family members back home. Again, like worrying is something that lots of people do, but when worrying becomes an anxiety problem is that people can't stop themselves. People can't stop themselves from worrying. And it's like worrying almost like every single day. Maybe I'm worrying about this thing and then I took my mind off it. Maybe I'm worrying about my family member and I was able to kind of stop myself. And then I started something else. Maybe I'm going to start worrying about money. Maybe worry about something else. And the thing is that a lot of these worries are very, very real, right? Like what we were talking about before, where sometimes coming to Canada means that you might need to take like a pretty significant pay cut, or coming to Canada means that you need to leave people behind at home. Like, yeah, it makes sense that people are worrying about elderly parents, for example, what happens to them when they're still at home. But really kind of what I'm talking about with like anxiety conditions, that it's like way too much to the point that it's actually causing you a lot of distress. It's impacting your ability to go to work, your ability to spend time with your family and friends, your ability to do things for yourself, along with these like physical symptoms that I was talking about earlier. So it could be just like restlessness, I can't kind of stay put, just having really tense muscles, feeling like tired, weak all the time, concentration problems again comes up, feeling irritable, like anything can kind of set you off, anything can make you really upset and angry. And then of course, again, sleep problems. So as I was talking about, sleep and mental health are highly intertwined. So then that brings me to PTSD. So PTSD is something that happens to some people who experience trauma, and PTSD can be sort of thought of like there's like 4 groups of like symptoms that people experience that may lead either a doctor or psychologist to diagnose them with PTSD. The first group of symptoms is as if it's kind of happening again. So I'm sitting here, I'm doing my thing, maybe I'm trying to concentrate on reading this book or I'm watching a movie, and then all of a sudden I have all these like thoughts, memories coming back, even though I don't want them to. I'm not like thinking about what happened, but all of a sudden it just came out of nowhere and I can't really kind of stop it from playing. Sometimes people may also have nightmares, and to more kind of extreme, people have something called like flashbacks. So it's almost like I'm sitting here and then I just feel like this huge kind of like emotional response, because it's as though like it's happening again. Of course, these things are really, really upsetting, right? Like you're having memories of some difficult things that happened to you in the past. Of course, it's really upsetting. So then what happens to people with PTSD is that they start to avoid it. So people may sort of like avoid thinking about it, avoid kind of talking about it, avoid people who remind them of what happened, or avoiding places that sort of like are related to what happened before in the past, avoiding their emotions. So it could be like avoiding what's happening inside, but also what's happening on the outside. The third group of symptoms related to PTSD is really kind of changing the way we think and feel. So trauma, as we talked about before, sometimes people may blame themselves. I should have seen it coming. If I should have known better, I could have do X, Y, Z to protect my family, but I didn't. Sometimes you will also blame other people, which makes sense, right? Like if those people sort of like cause us the trauma and pain, like we're sort of like constantly blaming, like they're the ones who caused it. On top of that, sometimes like people may start to like just not be interested in activities. So kind of similar to depression. So like sometimes there's some overlap between depression, anxiety, PTSD. you see that sometimes these symptoms are like the same. So like not interested in things or not wanting to do things, wanting to isolate themselves even more because maybe people are just sort of like blaming themselves inside, having really hard time having like really sort of like positive, pleasant emotions. And then the last group of symptoms can be called change in arousal. So what that means is that like people are sort of like constantly watching over their shoulder, constantly just waiting for something to kind of happen. And then maybe they're more easily startled. So with PTSD, like again, talking to a psychologist or a physician to sort of like see which some of these symptoms that people may be experiencing, and people would need to sort of have like all four of these kind of like all four groups of symptoms in order to be diagnosed with PTSD. But certainly just because people may not have a full PTSD diagnosis doesn't mean that trauma is not distressing. Something that comes up for some people is that they start going on using substances to cope with mental health problems. With substances, like the problem is that like substances, rather is alcohol, cannabis, other types of like substances, they find the problem is that like using substances to cope is one of those like really kind of unhelpful, like short-term strategy, right? Because when you think about using substances, is a way to sort of like avoid all these things, which I get, like I totally understand it, right? It's like, I don't want to experience depression. I don't want to experience anxiety. I don't want to experience PTSD. And then using substances is such a nice kind of easy way to kind of check out altogether. But then what happens to using substances is that like sometimes when people having a mental health concern, they're using substances to cope, but the substances also kind of make the mental health problems even worse, right? And then if their mental problem gets worse, they might need to use more substances, and then they might go on to develop a substance use disorder. So what that means is that like sometimes like people can't stop themselves. It's like I use it more and more. I'm spending a lot of time sort of like try to get substances, use it, recover from substances, and starting to see that like my substance use is now having a negative impact on my life. I am not going to work, or maybe I go to work, but I'm just like really hungover, or I'm not doing things at home. I'm canceling plans with my friends and family because maybe I'm actually too drunk on alcohol to even get in a car. I can't even leave my home. Maybe I'm getting into more fights with like my family members because they're saying that, oh, maybe you should talk to someone about your drinking. And then I'm like, no, I don't have a problem. And I'm getting more and more fights, but I'm still kind of using. Risky use means like using substances in really dangerous conditions. Driving comes to mind for a lot of people. But certainly, like remember how I was talking about like mental health and substance use, that they make each other worse. Even knowing that like my substance use is causing me more anxiety, I'm still going to keep on using. So that could be another sort of form of risky use. And then substances, because of their the physical nature, like sometimes like people also build a tolerance, right? So what that means is that they need to either use more to get the same effect, or they use the same amount as before, but they actually feel less effect. And then sometimes substances also have some like pretty nasty withdrawal effects that happens as well. The last little bit here, I really want to kind of talk about what are some ways that people can look after themselves. And I think oftentimes when I talk about trauma and mental health, one of the first things I really get people to think about is like, how can you take the time to look after yourself? People may say, oh, you know what, I have so many things to do, I just don't have time for that. Or if I spend time to look after myself, this is like selfish. I need to like do things for my kids. I need to do things for my husband or wife. I need to do things for my elderly parents. I need to like do all this stuff. I think what you have to really remember is that, sure, yeah, you got a point. Like all those things are really, really important. But asking yourself, what would happen if you kind of keep going in this sort of like car that's running out of fuel, so to speak? Like your car is running on fumes. that car will eventually stop moving. So like when I kind of get people to think about like, yes, you have all these things to do, but if your car is running on fumes, the car will eventually stop going. And then what about all these things that you said are important? All those people who may rely on you, who may be dependent on you, now get none of you whatsoever. Another analogy that like therapists talk about a lot is like thinking about like the last time you may be on an airplane where during a safety demonstration, they talk about putting your oxygen mask on first before helping others. It's again a really good analogy for self-care, right? Because on that plane, if the plane all of a sudden something happened and there's not enough oxygen, you can pass out. When you pass out, you're not able to help those around you, including your kids or maybe your elderly parents. And in fact, when you pass out, you may actually kind of create more problems, right? Because now someone else needs to rescue you. So really, the key big takeaway that I'm hoping people can walk away with today is like thinking about how important it is for you to look after yourself first. How do we do that? Maybe try to remember what are some things that we used to like doing before sort of like feeling low and or feeling really anxious. Maybe sort of like going for a walk in nature, reading a really good book, visiting a library to find like a nice book, making ourselves like a favorite meal, maybe like a meal from back home that reminds us of like the good times that we had back home, finding new things to do, checking out a museum. Making a plug here for the Ottawa Public Library, they have actually these like museum passes. So if you go to the library and you can look it up online, obviously, but if you go and just talk to the person at the front desk, you can ask them like, can you get a museum pass and or even an art gallery pass? So that way it's sort of like reduce sort of the financial costs, like because going to museums and art galleries can be quite pricey. So like you get a free pass. I think it's at least 2 adults, if not including kids as well, or going on Thursday afternoons. Those are free. Again, maybe like discovering a new place, going for a long drive. I know that gas is pricey right now. Maybe finding a new hobby. Really making a time for it. Like, yes, you have 5 million things to do, and I get it. We all have so many things to do. But again, coming back to why is it so important to look after ourselves first? Maybe it's going to be like, I'm going to use a calendar and actively just write it in my calendar, like schedule that activity in, just like how I would schedule in a doctor's appointment, for example. I'm not going to like just not show up because I need to kind of like, I don't feel like doing it today, but rather it's like my self-care is so important. I'm going to like write it down on my calendar. I'm going to try to schedule things where I can sort of feel some sense of fun, or hopefully like both sense of fun. And I'm also going to schedule some things that makes me feel really accomplished, right? So maybe it's like learning a new skill, trying a new recipe, and then seeing like how, yeah, wow, like I made this, and I now get to share this with my friends and family. Connecting with friends and family is super, super important to look after yourselves after trauma, and we might be experiencing mental health concerns. Just because that the more we kind of isolate, oftentimes the worse those symptoms kind of get. Finding new ways to feel safe can also be really important as a way that we can start doing. Remember how I was talking about how sometimes trauma memories just kind of take us back to like, oh my goodness, I'm just at home, I'm doing nothing, all of a sudden it kind of took me back there. So finding ways to kind of come back to the present. So grounding, what that means is like using a physical sort of like senses, right? Like maybe I'm going to look around my room and see that there's I see a glass, I see my like headphone case, maybe I see my phone. So finding things that I can see and name and touch, maybe finding things that I can smell. So maybe I can like smell my lip balm here. Maybe I can smell my coffee cup from earlier. So using our senses, finding things I can hear, finding things I can taste, using our senses help us to come back when our mind kind of take us to all these different directions. Sometimes we will talk about like kind of like tapping different parts of the body, because again, it kind of feels like we're actually just like more connected with our own body. Deep breathing exercises can be really helpful. Really the idea, and I'll actually kind of like talk about some resources on how to do this. The reason why deep breathing and also tensing, releasing the muscles is that when you think about that fight or flight response, when we feel anxious, maybe heart is kind of beating faster, or breath is more shallow, those like butterfly stomach feelings, we can't really do a lot to kind of make those stop. The few things that we can do is using deep breathing and tensing and releasing the muscles to kind of like help us to like slow ourselves down. So I can't tell my heart to slow down, but I can sort of control my own breathing. I can't tell those like butterfly in stomach feelings go away, but I can like tense and release my muscles as a way to kind of feeling more relaxed. These are some excellent resources that I use with a lot of clients. There's a website called Anxiety Canada, and in fact, they have a very cheeky page called How to Chill. And if you go on this page, you actually see that like they kind of walk people through exactly how to do deep breathing exercise. They even have like audio files so you can just follow along. How to like tense and release your muscles. Again, they have audio files kind of you can follow along. They also have this PDF that talks about like what are some things that you can do already if you think you're experiencing symptoms of PTSD, or even if you experience trauma and you may not have PTSD. It talks about some of the things I talked about before, where it's like grounding, helping kind of people get oriented, building connections with people. So if people are interested, they can check this out, because this is a really nice kind of summary as to like what to do PTSD. Sometimes people may say, I don't know, like for self-care, I don't know what I want to do. Nothing kind of feels really nice or fun. There's 101 ideas on this blog post about sort of different ways that people may want to try to implement self-care stuff. These are some community resources that I think are excellent. Counseling Connect, you can literally talk to a trained counselor for free. I think the appointments are usually like within a day or two. You can connect with like specifically like organizations like OCSO, who do a lot of work related to immigrants and refugees. You can also connect with organizations that may be like closer to you, like your community health center. Obviously, Ottawa Public Health has tons of really good resources, and I think they have a directory. They have a directory sort of for different resources. Again, remember how I was saying earlier, if you start noticing that you may have thoughts related to life is not worth living anymore, it may just be easier if I'm not here, to sort of like more upsetting thoughts like this is how I'm thinking about hurting myself, please do use these resources. These are trained workers who are able to kind of talk to people about how to de-escalate. Getting professional help may be something that eventually, when you feel that you're more ready to sort of work on mental health stuff, just because I know that like when people first come to Canada, the first year is really hard. There's so much other stuff that I need to kind of figure out. I need to kind of get my kids in school. I need to find a job. I need to find more stable housing. There's a lot of stuff that I need to work on. So I get it, but like sort of when people are slowly more settled, sometimes those mental health symptoms come up more. Like when you think about like that honeymoon phase, and then down to that uncertainty and doubt phase, once people kind of get over the honeymoon phase and they also have met their basic, like a lot of those like basic kind of needs, they kind of get into like the mental health symptoms tend to kind of flare up. So then like getting professional help might be really important. The first thing I'll tell you people to do is go talk to your family doctor first, because that's probably your number one easiest kind of option to get started. They may be able to talk to you about trying medications if you're interested, or they may also be able to connect you with like some psychotherapy services in the city that are free, but sometimes they may need a doctor's referral. And by these resources, I'm talking about, for example, the Royal, which is a mental health center here in Ottawa, where sometimes they are able to see a psychiatrist for like consultations. And so they may not meet with the same psychiatrist every time, but at least they can kind of get started. The Royal offer also this program called Ontario Structured Psychotherapy Program. And it's a fairly new program that's kind of taken place in Ontario for the last like 2-3 years, where you actually get free psychological therapy. Most of them are done as like cognitive behavioral therapy with a trained social worker, occupational therapist, or even psychologist. And what they do is like, I think people get like 10 to 12 sessions for free at OSP, working on depression, anxiety, trauma stuff, but that needs a referral from the family doctor. Hence why I said talk to the family doctor first. For people who may be experiencing addictions and substance use problem, Rita Wood is excellent at what they do, sort of like providing support. These two, the last two resources are people have to pay for. One is at the University of Ottawa, where I got to school at. The University of Ottawa has a psychology clinic that's like, you meet with like psychology students, so they're not just like any student, but rather they're like PhD students who are training to be clinical psychologists. And you can actually meet with like a student therapist there for much sort of lower rate compared to what you'll pay in the community. And all these students are supervised by psychologists. So it's, yes, it's part of their training, but at the same time, like there's someone who's overseeing the work. So there's a link here. And then finally, there are private services in the city. They can get pricey really, really fast. Unfortunately, like I think the going rate in Ottawa is somewhere between 150 to 220 an hour to see a social worker, all the way to seeing clinical psychologists. Recognizing that some people in the room may actually came to Canada as refugees. For those people who are refugees, they may also be eligible for this program called Interim Federal Health Benefits Program, which means that the federal government may actually like pay for those services. So if this falls into, like if this is something that applies to you, certainly talk to your family doctor, talk to organizations like OCSO as to like how do you kind of use those money to kind of get started with a psychologist or social worker. And then those of you who may have like private insurance, going the private route may also sort of give you more options, so to speak. I was going to talk just very, very quickly as to what is CBT. So this is just a sort of like a quick slide. This is something, for example, like let's say I'm someone who gets really anxious around making presentations. So what happens, like my environment here, I'm making presentations. And then I start noticing like, oh, wow, I'm going to just make a fool of myself. I'm going to say something really, really dumb. And people may see how nervous I am. And then, of course, from that, I may start experiencing emotions like anxiety. From the emotions, I'm noticing that there's like butterflies in my stomach feeling, my palms are getting sweaty. And maybe what I end up doing is like, I'm just going to put this off. Or maybe I'm going to spend like 20 hours making this presentation, memorizing things word by word. So which may not be the most helpful, right? So what CBT is really kind of talking about is like changing the way we think or changing what we do as a way to sort of change our emotions. So CBT treatment is one of those things that like is highly recommended for people with depression, anxiety, and also trauma. So just going to give you a flavor of what CBT could look like. And then finally, these are some sort of like workbooks that I really like for clients who may say, you know what, like I may be waiting for OSP, but it's going to be a while, or yes, I would like to engage in psychotherapy, but right now I just don't have the funds for it. Or the waitlist is really long. These are some books that I really recommend to people if they're just kind of interested in like getting some more help on their own. You can find these books on Amazon, Chapter, the local bookstore. They're not too expensive. They're about $30 to $40. So it may be something that can kind of help you get started. And then the last link, the last thing that I want people to kind of check out is also this like resource. They're based in Australia. But that doesn't mean that people can't use it. And what they do is like they have created these like modules for common sort of like mental problems that many people have related to like depression, anxiety, low self-esteem, overeating, not being assertive. So they actually have like tons of like really good resources. If you go on it and sort of like select which problem you want to work on, they actually create these like modules. So it's like sort of like just each module is like maybe 5 to 10 pages, all very like simple kind of English broken down with examples, and people can kind of actually try to learn to do like CBT on their own. So that may be another resource. So I think it's around 12:55 right now. I'm open to any kind